Hi, my name is Marlene Merritt, and I'm the owner of Merritt Acupuncture. We are a full-time Oriental medicine practice that's located in Austin, Texas. I have the privilege of being able to work with my husband, Will Mitchell, who is also a practitioner of Oriental medicine here. And we have on staff here 3 acupuncturists. We're also full-time herbalists, and we also have a massage therapist here. As you can see, we also have a full pharmacy on site, and we treat everything from cancer to the common cold. I'm here to answer questions about Oriental medicine, and if you have more questions, please visit us on our site, which is merrittacupuncture.com, and Merritt has 2 R's and 2 T's. So a very popular question is, what is acupuncture and how does it work? Well, acupuncture is based on a completely different medical model than Western medicine. So it's based on an energetic model, which means that, for starters, the vocabulary tends to be different, which is why the 2 camps seem to struggle a little bit in being able to speak with each other. But Chinese medicine is based on the understanding that energy should always be moving freely throughout the body, and that when it gets stuck, that's when illness results. And so the illness will come up with different symptoms. And so when I'm talking to patients about this, it's almost a given that when people come in with something, they've probably had it for at least 10 years. And if you're, substantially older, it might even be 20. And the way Chinese medicine looks at it is that, probably about 10 years ago, you had some energetic shift that if you were a very skilled acupuncturist, you might be able to see that. Like, you probably wouldn't have any physical symptoms unless you had this for a while, and then a few years go by, and you might have some symptoms that tend to be a little more fleeting. Things that don't register on an x-ray is how I describe that. So, like, you get headaches, or you have stomach pain when you're stressed, or, you have things that aren't measurable. And so usually the way medicine, in Western medicine, that's not something that you deal with a whole lot. So people just sort of hope that maybe it'll go away, and so time will go on, and they'll end up having more physical symptoms, like they may have a herniated disc, or they'll end up with a, ulcer, they'll end up with a tumor. And that's when they end up going to see the doctor. So this is, 10 years later or something like that. And the doctor, then I always feel badly for them because they're ending up working with something and trying to shift something that's now much more physical, when 10 years ago it was energetic and much easier to work with. So we work with people in all areas of that spectrum. We have people who come in with something very physical, and we can make a difference with that because we treat that as well as the root, which started, whatever period of time before. So being able to work with both of those allows the person to get better for the main reason that they're here, as well as being able to get healthy and then be able to stay healthy, which is really the focus of Oriental medicine, is being able to keep people healthier. And that's what we focus on.